Mr. President, I'd like to call up Amendment 2901 and ask for its immediate consideration.
The clerk will report.
The Senator from South Dakota, Mr. Thune, proposes an amendment number 2901 to amendment number 2786. Beginning on page 1925, strike line 15 and all that follows through line 15 on page 1979.
Mr. President.
Senator South
Mr. President, I'd like to speak to the amendment that we just filed at the desk. And what this amendment would do, it's very straightforward, it's very simple. It does what a number of my colleagues on the other side have asked to do, and that is to strike the Class Act from the underlying health care reform bill that's being debated on the floor of the Senate right now. And I want to read for you some excerpts from a letter that 7 Democrat senators, including the chairman of the Senate Budget Committee, Senator Conrad, put together, asking that this Class Act not be included as part of this legislation. They said this: "We urge you not to include these provisions in the Senate's merged bill, nor to use the savings as an offset for other health items in the merger. While the goals of the Class Act are laudable, finding a way to provide long-term care insurance to individuals, the effect of including this legislation in the merged Senate bill would not be fiscally responsible for several reasons." And it goes on to say that nearly all the savings result from the fact that the initial payout of benefits wouldn't begin until 2016, even though the program begins collecting premiums in 2011. It is also clear that the legislation increases the deficit in decades following the first 10 years. They go on to say in this letter, Mr. President, "We have grave concerns that the real effect of the provisions would be to create a new federal entitlement program with large, long-term spending increases that far exceed revenues. This is especially the case if savings from the first decade of the program are spent on other health reform priorities." That, Mr. President, is a letter that was signed by the chairman of the Senate Budget Committee, Senator Conrad from North Dakota, Senator Lieberman, Senator Landrieu, Senator Lincoln, Senator Warner, and Senator Nelson and Senator Bai. 7 Democrat senators who have gone on the record saying the Class Act shouldn't be included in this legislation because it's not fiscally responsible. And the fact of the matter is, Mr. President, the chairman of the Senate Budget Committee, Senator Conrad, has gone on to say and describe this as a Ponzi scheme of the first order, something that Bernie Madoff would be proud of. Now, I've heard my colleagues on the other side get up and talk about how solvent this is and what a great program this is. Well, there are programs out there that are available for people to buy long-term care insurance. The problem with this one is it takes all the money that comes in the early years and spends it on other government programs, in this case health care reform, but who knows what other government programs are going to be created that will use the revenues that come in from this plan that supposedly a lot of people are going to sign up for. Now, CBO says it's going to be fewer than 4% of people that are actually going to sign up for it. And in fact, no senior today is going to benefit from it because you have to work 5 years. If you're a senior who's retired, you're not going to see any benefit from this. So this doesn't impact seniors, contrary to the assertions of some of my colleagues on the other side. Who it will impact are future generations of Americans who are going to be stuck with the deficits and the debt that gets piled on them. Because in the out years, when this liability is incurred as people start getting paid out from having paid in, there's no money there. It is a classic definition of a Ponzi scheme. The money comes in today, it gets spent on other things, and then someday when the liability comes in and people start saying, "Oh, I paid into this program, I should get some benefit," there's going to be money there. And so we're going to borrow for it, or tax for it, or something else. But because they say, well, it's actuarially solvent over 75 years. Well, maybe because you're running surpluses in the early years, but in the later years, you're running huge deficits. And in the early years, the surpluses are being spent. They're not being put into paying benefits out for this program when those benefits start being demanded by the people who have participated in the program. But you just look at what others have said about this program, Mr. President. I quoted for you what the chairman of the Budget Committee, Senator Conrad, said with regard to this program, that it is a Ponzi scheme of the first order. But that is being echoed by others. Now, this is what the chief actuary and the administration's chief health actuary said about the Class Act. Said it would result in a net federal cost in the longer term. The chief actuary also determined that the program faces a significant risk of failure because the high cost will attract sicker people and lead to low participation. The Congressional Budget Office agreed, saying that the class program included in the bill would generate net receipts for the program in the initial years when total premiums would exceed total benefit payments, but it would eventually lead to net outlays when benefits exceed premiums. In the decade following 2029, the class program would begin to increase budget deficits. Now, this particular quote could come as a bit of a surprise because this comes not from the CBO or the CMS actuary, but it comes from the Washington Post. The Washington Post called the Class Act a gimmick designed to pretend that health care is fully paid for. The Post goes on to say, Mr. President, that the money that flows in during the 10-year budget window will flow back out again. These are not savings that can honestly be counted on the balance sheet of reform. Even the Washington Post recognizes this for what it is. It's a sham. This is a budget gimmick, Mr. President, that is designed to obscure the cost of this program by generating surpluses in the early years. $72 billion it's supposed to generate in the first 10-year window, and so that counts on the balance sheet of health care reform to make it look better. But this program is going to run deficits as far as the eye can see once the chickens come home to roost. And who's going to pay the bill for that? Future generations of Americans. Mr. President, this is not good policy. It's certainly, you look at programs that we already have on the books. Medicare is destined to be bankrupt in the year 2017. We've got big problems down the road, unfunded liabilities in Social Security. What this would do is create a huge new liability down the road that would be unfunded because all the money that comes in the early years is going to be spent. This is more of the same old business as usual in Washington, D.C. that the American people are fed up with. And we can make people happy today by saying we're creating this new program. It makes the majority's health care reform bill look better because it obscures the real cost of this thing by rolling in these revenues in the early years. But the long-term impact, according to the CBO, according to the actuary at Health and Human Services, according to a lot of our colleagues on the other side, 7 Democrats who signed the letter, including the chairman of the Budget Committee, who, as I said, has called this program a Ponzi scheme of the first order, something that would make Bernie Madoff proud. Now, I don't know how my colleagues on the other side with a straight face can come over here and say, well, this is a really great program, it's actuarially sound, and sure, it may be a benefit to a few people. But I got to tell you, somewhere down the road, when the chickens come home to roost, there is going to be a huge liability that is going to be facing future taxpayers, future generations of America, as we start to pile up more deficits and more debt as a result of this Ponzi scheme. This is a sham, Mr. President. I hope that my colleagues will support this amendment. It would strike the Class Act from the underlying bill, not allow those revenues to be assumed in paying for or understating the cost of this bill, and not pile mountains of debt on future generations. Mr. President, I reserve the balance of my time.